Merhabalar, ben Doktor Ayşe Çallıoğlu, dermatoloji uzmanıyım.
I would like to give you a little information about hair transplantation today. Hair transplantation is a surgical procedure. As with all other surgical procedures, it should be performed in a sterile environment under operating room conditions. It is very important that all devices used are sterile. These applications can be done with the authorized team and under the supervision of a specialist physician. These specialist physicians should be plastic surgeons or dermatologists. This is the legal form. While performing this application, do our patients have previous diseases, chronic diseases? Which medications do they use? We determine their age, the level of hair loss, and the type of hair loss. Accordingly, the application is performed after all the safety conditions of our patient are met. Another important point here is the adequacy of the amount of hair in the donor area. The area we call the donor area is the area just above the nape of the neck at the back of the head. The hair in this area does not fall out. We transplant the hair we take from here with a special method to the local areas where there is hair loss, usually to the crown area or to the local areas where there is hair loss. The hair transplantation process takes an average of 6 hours, and the patient is discharged that day. General controls: washing the hair, whether there is an infection, whether any complications have developed or not. After all these controls are completed, our patient can return to his normal life within an average of 1 week. Who can have hair transplantation and who cannot have hair transplantation are also important questions. Hair transplantation can actually be applied to healthy adults, men and women of all ages. But in some special cases, people have questions. Can hair transplantation be done to these people, accompanied by general information? The group we do the most hair transplantation is men and women with male pattern hair loss. Male pattern hair loss is a genetic hair loss and is a local hair loss in the area we call the vertex in the vertex region of the hair. This is also a hair loss that we can also see in women, especially male pattern hair loss, which becomes more pronounced in the postmenopausal period, is also a problem for women. Hair transplantation can be applied in both genders. Men and women who experience intense hair loss due to chronic diseases can also consider hair transplantation and hair loss after any local infection or hair loss after any injury. Also, frontal hair loss caused by too tight hair collection, which usually happens to women. In cases such as the hair going backwards from the forehead, we call this tractional alopecia. Hair transplantation can be easily done to these people. Hair extraction can be performed on the area with complete hair loss or only for thickening. Although there is generally no age group that we recommend, there is no need to wait for complete hair loss, especially in men. Hair densification and supporting the hair loss area is recommended for both the comfort and psychological well-being of the patient. At this age, it is usually between 20 and 30 years old. Since hair loss continues even after the age of 40, we can redo the shedding areas. So we don't have to wait for the hair loss to stop completely. There is no need in this sense.